Reduction forehead, contouring only. The physician performs surgery on the forehead to correct a skeletal deformity. With the patient under anesthesia, the physician makes an incision in the hairline to expose the forehead of the skull. The deformity in the bone is identified and fully exposed. The physician uses a variety of surgical instruments to reshape the bone to make it follow a more normal contour. The wound is irrigated and closed in layers. Reduction forehead, contouring and application of prosthetic material or bone graft, includes obtaining autograft. The physician makes an incision in the hairline to expose the forehead of the skull. The deformity in the bone is identified and fully exposed. The physician uses a variety of surgical instruments to reshape the bone to make it follow a more normal contour. Prostheses may be applied and/or autografts may be harvested and applied as part of the procedure. The wounds are irrigated and closed in layers. Reduction forehead, contouring and setback of anterior frontal sinus wall. An incision is made at the forehead hairline or the eyebrows. The forehead is exposed directly over the frontal sinus wall. The deformity or deficit is identified. Soft tissue is debrided. The physician reshapes the anterior wall of the sinus. If the wall is prominent or badly misshapen, the physician elevates it from the forehead and resets it in the appropriate anatomic and cosmetic position. Fixation devices such as wires may be required to maintain the repaired wall. The wound is irrigated and closed in layers. Reduction of masseter muscle and bone, e.g., for treatment of benign masseteric hypertrophy, extraoral approach. Intraoral approach. The physician makes skin incisions in the neck just beneath the angle of the mandible. The tissues are dissected to expose the masseter muscle and mandible. The physician removes appropriate amounts of muscle and may use drills, saws, or osteotomes to remove bone in the area of the angle to produce the desired contour. The incision is repaired with a layered closure. Reduction of torsion of testis, surgical, with or without fixation of contralateral testis. The physician treats a torsion of the testis, which is a twisting of the testis upon itself so that its blood supply is compromised. The physician makes an incision in the scrotum and exposes the twisted testis. The testis and spermatic cord is untwisted to restore blood flow to the organ. If the testis is viable, the surgeon anchors the testis to the inside wall of the scrotum with 3 or more sutures. The incision is closed in layers by suturing. Because the problem that allowed the testis to twist may affect the other testis, contralateral testis, a second procedure is commonly performed to anchor it in similar fashion. Would it be appropriate to report code 54600 in conjunction with code 54512 during the same session? 54600 is not considered to be an inclusive component of 54512. Reduction of craniomegalic skull, e.g., treated hydrocephalus, not requiring bone grafts or cranioplasty. Requiring craniotomy and reconstruction with or without bone graft, includes obtaining grafts. The physician reduces an enlarged skull, e.g., secondary to hydrocephalus. The physician incises and retracts the scalp to expose the cranium. In 62115, the skull is cut and the bone is reshaped. In 62116, bone flaps are raised. After reshaping, the bony fragments are replaced and stabilized.